So when doing an SI joint reset exercise, what we're focusing on is understanding that our tendencies for our posture is that the right hip tends to be in more internal rotation while the left hip tends to be more externally rotated, which is going to cause that sacrum to shift a little bit more towards that left side. So with the right hip more internally rotated, it's going to shift back and shift that sacrum towards the left, which is going to tighten the space here, lengthen the space here of the pelvic floor. So what we want to focus on is movements that are going to encourage the pelvis to come a little bit more neutral. So either forcing the left hip into more internal rotation by activating the hamstring, by activating the inner thigh, and then we can also force it into that position by having different hip shifts. So we think drive that hip crease back. For the right hip to help encourage more of that external rotation, we really want to activate the glute, particularly the glute med, to help encourage it to pull the sacrum back as it comes to more of that externally rotated position. The other thing that's going to influence our pelvis is also how it relates to our rib cage position. So typically the right side is a little bit more compressed while the left upper back is a little bit more flat, and as we rotate more towards that right side. So what we want to focus on is finding more length here on the right side and more expansion in the upper back. So these SI joint reset exercises are going to encourage the pelvis from going from here to here by focusing on specific movements to reset not only the pelvis, but also the rib cage positioning because they influence one another. So the first thing that we can do to almost force the pelvis to emphasize a little bit more internal rotation on the left side to help shift is going to have some sort of elevated surface. So like a yoga block, I'm using a box here. So I can put my left knee onto it, and you can see how this is already going to shift my pelvis into more internal rotation on the left side. So to see it from behind, I have my left knee elevated. It's going to force it to be more internally rotated. And then I'm going to shift my weight towards that left side so that I'm emphasizing that internal rotation even more. So this by itself is already going to begin to shift my sacrum back towards the right side. The next thing that we can do is we can emphasize that hamstring activation and the glute activation with kind of a push-pull type movement. So essentially what I want to do is I want to push into the wall with my right foot as I pull my left foot up. So the foot is not going to actually move, but I'm creating that traction to activate in my hamstring. So I have this push and pull type movement that's happening with my feet against the wall to really try to force the SI joint to reset itself. So we're in this position. I'm in my elevated position with my left side. So this foot is going to be a little bit higher. Right foot, I'm thinking push into the wall. Left foot, I'm thinking lift or traction upwards. Now, when we want to consider the rib cage position, I want to drop to the left side. I'm shifting my weight to the left. So now I'm going to be able to find more expansion up here. And then to find that length in the right side, I'm going to reach across. So from here, I'm thinking pull the left foot up, drive the right foot into the wall. I'm thinking push my chest away here to find that expansion in the upper back, and then reach across. And then from here, I could take my big inhale, feel everything expand, and then exhale, release. Inhale to expand. And then you can just do a few breaths here or there. So with this movement, what we're doing is we're trying to have a lot of stuff happening at once to help reset the position of the SI joint, or reset the position of the sacrum. So we have that hamstring activation that's going to help force that left hip into more internal rotation. We have the glute activation on the right side that's pulling that sacrum back towards the center. So again, we have that push-pull type movement that's happening. We also have expansion in the right side because this side tends to be more compressed, while also thinking expansion in the left posterior rib cage so that we can reset the rib cage position as it relates to the pelvis.